Hey, what's up, everybody? This is Maggie Reichart, and you are listening to Nursing Uncharted. Thank you so much for listening, and if you're here for the first time, welcome. If you are enjoying the podcast, please let us know and write an Apple review for us on Apple Podcasts. I'm sure that the more reviews we get, the more available the podcast is to listeners, so anywhere that you listen, please like and subscribe on YouTube or follow us on Instagram at Nursing Uncharted as well. We have a great episode for you guys today. Nursing Uncharted has allowed us to talk about a variety of different ways that we can use our nursing licenses, and what better, more popular way to use this license than travel nursing. Am I right, fellow travelers? This episode, we are going to be getting into the travel nurse tricks of the trade, and I am here with fellow former traveler Hannah Quirk, a neonatal ICU nurse and the owner of the blog Quirky Nurse, to help me talk about just getting started as a traveler. Hannah has graduated from the Duquesne University School of Nursing in 2016. She began her nursing career at a level 3 hospital in Pittsburgh in their neonatal ICU and was there for 2 years before starting her journey as a travel nurse. Hannah traveled for 3 years, taking neonatal ICU assignments in California, Washington, Arizona, and Colorado. She documented her travels by creating a blog called Quirky Nurse, where she houses many travel nursing tips about getting started with traveling. She traveled with her boyfriend, Eric, who she actually met on an assignment. Hannah's travel journey has come full circle back to where it began in Pittsburgh, where she's recently taken a staff position. Hannah loves to hike, ski, spend time in the mountains, try new food, meet new friends. You can follow Hannah and Eric's travels on their Instagram, Roaming the States, and you can find Hannah's travel blog at thequirkynurse.net. So Hannah, welcome to the show.
Thank you so much. I'm so happy to be here.
Yeah, it's great. It's great to have you here.
Thanks so much for asking me.
Yeah, absolutely. I love your blog. I mean, and like all your photos on Instagram, like you've been to so many places.
Thank you. So have you.
Yeah. Well, let's get right into it because I think we have a lot of ground to cover when it comes to, tricks of the trade. Where do you think is a good place to start for people who are just thinking about the idea, maybe they've heard about crazy high weekly rates and they're intrigued, or, maybe it's been in the back of their mind for a while, but they just don't know how to get started. Like, where, in your opinion, is like a good place to start for those people?
Yeah, I think that can be one of the most overwhelming things for a new travel nurse. I think just starting out is like, there's so many different things that you need to check all the different boxes, Mm-hmm. So I think the best way to get started is to check out like a website like Wanderly Nurses or Vivian and kind of just see what's out there, what pay packages are out there.
Yeah.
Because right now is the time to start, like you were saying, with those big pay packages and everything like that.
Yeah. When I was traveling, I feel like I didn't really... I don't know if maybe traveling... I feel like traveling has become a lot more popular in the last few years. Like when I started in 2017, and I mean, websites like Wanderly or Vivian, like I had never even heard of. I was just using, like, I think I used like word of mouth, and I think I got started because there was a traveler on my permanent unit, and she was the first, I had never met another traveler before, and she was just very, I don't know, she would do her job and, just 12 hours and go home, and, it seemed like she had so much flexibility and freedom, and I mean, I used her I'd used her recruiter.
Yeah.
Because
I think if you have like another travel nurse that I think talking to as many people as possible, getting as much information as possible, going on blogs, listening to podcasts, obviously. I know I read a book before I started traveling because I was like so overwhelmed with all the information. And I think it's hard to really understand like how it actually works. So I think just gathering all of that information, and it's never been easier. Right before this podcast, I was looking up like when did travel nursing actually start? And it was like in the 70s. Can you imagine?
Yeah, I know. I remember I read a book too. Highway Hypodermics.
Me too. Yes.
Is that the book?
That's the one I read. Yeah.
Yeah. No, I read that.
And it was super helpful.
I remember seeing that in that book, and them being like, I think it's, started. And I was like, that's crazy to me, because I feel like I had just started hearing about it, like blowing up in the last few years.
But I feel like if you were a travel nurse in like the 70s or the 80s, I mean, where do you even hear about these jobs, first of all? Because there's no like internet at this point. So I don't even know how they found out about it. But, and then you're driving across the country with no GPS, and like, I don't even know how you would get started. So I feel like now it's easier than ever before. There's so many different resources. You just have to kind of go out and find them. But yeah, just gathering that basic information and kind of figuring out, okay, like where am I interested in going, and what jobs are even out there? Because I think a lot of the time, at least like when I was starting out, I was like, I only want to go to San Diego. Like I was very set on a certain place, which I did end up getting, which I was lucky. But I think sometimes you don't get your first choice. Yeah. So I think it's really good to like just be open, see what's out there, and then get that state license. And that's like a really good place to start.
Yeah, absolutely. I remember from that book, there was one thing that stuck out in my mind when there was like a getting started portion of that book. And it was like, write out all of the reasons why you would be hesitant to start traveling, and then write out all the reasons, that you want to do. It was kind of like a exercise that, asks like, is this really something that I want to do? What can I anticipate being challenging, And I think mine at the time was, I was dating somebody that was going to have to be long distance, and I was like going to be away from my family. A lot of times you travel on your own, so like that can be scary. Like that, I think those are my challenges. And then obviously my advantages, where this is something I've wanted to do for a really long time. Like I can make more money as a traveler than, I could pay off loans. I can see places I've never I can live somewhere instead of just like being a tourist for the weekend,
Yeah. I think writing out the pros and cons list is a really good way to start out too. And there's always going to be fears, I think. Yeah. I mean, I know I was really scared too. Yeah. But I think if you're interested in it, and you know that you already are interested in it, I think you just need to go for it, because I think the only thing that ends up holding you back is your fear. Sure. And then I think once you actually conquer that fear, it's huge.
We want to take a quick break from this episode to talk about the industry leader in travel nurse staffing, American Mobile. Combining the largest network of facilities and providers in the country with top-level benefits like higher earning potential, premium health insurance, and 401k matching, American Mobile puts you in the driver's seat of your travel nursing career. Make sure to visit AmericanMobile.com today to discover a world of adventure with American Mobile. That's AmericanMobile.com, the first step towards your next travel nursing adventure. Most people that I know that are travelers, I mean, they love it. It's those first few weeks are really hard. I mean, because it's like completely different than any type of, you're thrown into a brand new, policy and environment, and you don't know anybody else, and
you don't know where anything is.
You don't know where anything is. You don't know how to page a doctor. You don't know how to.
You don't know the doctor's name.
Right. Yeah. It's a different phone. Like I remember, my first assignment, it was a brand new unit. And so it was like half travelers, half float pool, and nobody knew what was going on. It was like, just
the blind leading the blind.
Yes. And I just remember being so like, I don't know how to do this. And then I like just kind of calmed. There was a moment where I was like, no, I can figure this out. Like this will be fine, because I know how to be a nurse, that's the biggest thing you always have to remember. It's like, the nursing, like day to day, your rapport with patients, like your, assessment skills, your communication skills, like all of that is the same. Yeah. I remember being like the first few days of an assignment, getting report from a nurse and like in your head kind of internally being like, okay, is that like really the policy? Or, you know, just getting kind of sidetracked with all of the things that you're worried about. And then you go into the room and like my like spiel to the patient was like exactly the same. And that like would, you know, give me a little bit of confidence. Like,
yes,
like I know how to do this. Like
exactly.
I will figure it out.
Yeah, I think like not focusing on those minor differences, because there will be differences, especially if you've only worked at one place before you started traveling. Like that's what I did. Is that what you did too?
Mm-hmm. Yeah.
Yeah. And then I think like you get taught a certain way. So in your head, you're like, oh, this is correct.
Yes.
And then you go somewhere else and they, I don't know, like they don't check residual on a baby. They just check placement and then you don't measure it or something. Like a lot of places are different with little things like that. And it's like, oh, well, where I came from, we did this. And it's like, just
like, you're not
avoid
there.
that. Yeah. Just avoid that and just be like, okay, like this is how you do it here. And like go with the flow and people will like you.
Yeah. I think policy, figuring out the policy is your best friend. Just like figure out where is the link to the policy, you know, for this hospital. Like that will be your best friend. Like then you'll be fine.
Exactly.
But sometimes, I mean, hospitals don't have those same, you know, setup, like structural setup. Then a lot of times you like depend on word of mouth of how to do something. But I mean, you just have to. I think like fostering relationships early on is probably really important in a travel assignment, because then you are more comfortable like asking people for things and questions and like how to do this. And
definitely. Yeah. Yeah. I would always like become on my preceptor's good side, because you get the 2 days of orientation.
Yeah.
So then I would just make sure that, you know, they were someone I could depend on. So, because you're going to have questions. 2 days of orientation is never enough you're never going to know everything about a unit in 2 days. Yeah. Like, it's just not possible. But what you can figure out is, where to find the policies, where to find the equipment, where's the crash car, like, what are the most important things? And then everything else you can ask along the way. And I still ask questions. I mean, I would be somewhere for 6 months and I still had questions, you know?
Yeah, so. Absolutely. I remember my first assignment, like I said, it was half travelers, half float pool. And so there was a new traveler coming on and I was orienting that traveler for the 2 days. It was hilarious because like I had been there. Yeah, it was like I had been there for like, I don't know, a few weeks, maybe. And she had been traveling for like 5 to 7 years maybe at the time. So like, you know, nothing fazed her. And she kind of taught me how to come into your assignment. Like she was like, okay, just show me where everything is, you know, like tell me where the supply room is and like show me all of like where are these things and like how to page a doctor. And, you know, she wasn't overwhelmed by it at all.
Yeah.
And I was like, okay, I mean that this is, you know, it makes sense.
Yeah. I think the longer you do it, I mean, the more comfortable you are and you know exactly what to ask going into it.
Yeah.
That first assignment, though, it can be very overwhelming.
What was your first assignment? I was out in San Diego.
Yeah. And I floated to a lot of different NICUs in the county. So, and it was a really good experience because it was like level 2, 3, and 4. So, and they were all different sizes and everything. So I think it was actually a good place to do my first assignment because you got exposed to a lot of different places really fast. But I never worked with the same people. Like every time I went to work, it was like, "Hi, I'm Hannah."
That's a hard one to start out in because like not only are you like the first to float, but you're literally going to different hospitals like every day. Like they would call you and be like, "Hey, you're going to go to this hospital today." Like that's wild. Like, you know, 2 days of orientation is you don't get 2 days at every hospital. You get 2 days wherever you get 2 days. Yeah.
Looking back, I'm like, that's a lot to start. But I think I'd rather have done that first than get comfortable with like one place and then go to that. Then I think I would have been like, this isn't normal. But starting out there was, I think, a good experience overall. Yeah.
Yeah. I had to do that once. I did it in Denver.
Nice.
They would like send me to one hospital or another hospital. And like at first I was, you know, overwhelmed. But then, you know, I mean, it was I never went anywhere other than like 2 different units. So in a sense, it was just a matter of like driving to one versus the other. But I kind of like got an idea of how both places worked. But
yeah.
How have you gone about, or how did you start about choosing a recruiter or an agency? Like where did you start, and how did you go about that?
I think that's overwhelming too. I remember in the book that we read, the Hypodermics book, they had a list of every single agency, and I took notes and I wrote down every single one. I did too. And I was like, I don't know. How do you know which one to go with? So I think that can be overwhelming. I think, like we said before, if you talk to a travel nurse that you know, just see who they're working with, see if they like their recruiter, and if they do, get their name. Because I think there's some agencies that are obviously better than others, but I think the most important thing is if you click with your recruiter, because you want someone that's going to pick up the phone if you need something, if you're in a situation where you need to ask them something, or because they're your go-to person. So having a recruiter that you trust, I think, is most important. So going through a travel nurse that you know. I've gotten lucky too. I had a random recruiter that we ended up clicking with. So you just never know. Same. But I think if you're putting your information out there to tons of different agencies, it's just going to be too much. I would see which agencies have the jobs that you're looking for, and maybe the pay packages that you're looking for, and then stick with a couple. Yeah. But be at the same time being open-minded if another one pops up. That's your dream job. Yeah. So it's kind of that fine line.
I think that's a good thing to point out is don't give your phone number out to a bunch of agencies.
No, they will harass you
up. They will blow you up.
Yes.
Yeah. I still get, I get texts like nonstop, and I should just text them back and be like, hey, I'm permanent staff for now.
Meanwhile, we're just ignoring them.
I do kind of like to know what the rates are, though. I get a kick out of oh my God, Oregon is paying $10,000 a week.
Right? I know. I still get the emails from Wanderly every day probably, and I just torture myself because I'm looking through and I'm like, oh my gosh, I could make $5,000.
It really is torture. That's what it is. It's torture.
And then you look at your paycheck.
Why am I doing this to myself
as a staff nurse? And you're like, why did I stop traveling again?
Yeah. What? Really? Am I doing this? Yeah.
Pros and cons to both, for sure. Yeah.
Yes. I got lucky with my recruiter too. When I had a random, we hit it off. I remember he was just starting out, and so I kind of felt like I think he was still trying to build his nurse base. Yeah. And so I think he really took a lot of, he was really motivated to establish a relationship with me, and all of our conversations were great, and he was always there. I got a lot of gifts. Aww. And there was one time I think he sent me a birthday card, and he had drawn the New York skyline on the birthday card because I wanted my next assignment, we wanted to go to New York City. It was great. I didn't end up using him, I think, for more than one, because I think the rates weren't as good, and so, which was kind of a shame. But sometimes I think in my experience, that recruiter that was younger, that was still trying to build up their base, I felt like he really would go to bat for me.
Me too. Yeah, I feel like I had a similar experience. Mm-hmm. Yeah, I remember when I was in Phoenix, it was last winter, so it was right in the height of COVID and everything. Mm-hmm. And they floated me to adults, which was terrifying for me, just because I don't really have that experience.
They can do that. Yeah, there's different. You calculate everything differently,
a whole different world.
Yeah, it's a whole different world.
You're adult ICU, right?
Yeah.
So that would be you going to take care of a micropreemie.
I'd be mortified.
Right?
I'd be terrified. I would be I don't want to touch this little.
What is this?
Little baby?
What is a UV? What is a UA?
Yeah.
But I don't know the lines for an adult, and all the meds are completely different, and So they floated me there, and at first I thought I was going to take an assignment or something, and I called my recruiter, and I was like, is this okay? You know, like, or like, is this allowed, or what should I do? And he walked me through everything, and he answered, and it was like 8 p.m. So just having someone in a situation like that you can reach out to, and they're not annoyed, and they're helpful, and they have your back, you know?
Yeah.
And his answer was basically like, I'll support you whatever you want to do, which I loved that, because it was awesome. Like, I just knew that he was in my corner.
Yeah. I feel like that was really probably hard to find last year too, when it was, because think of, you know, in their perspective, like being a recruiter, they are just getting complaints at all
day,
the time, all day. Like, this is terrible. The assignment is awful. My like ratios are awful. And like, just to have somebody that was like, I completely understand and I'll go to bat for you. And you know, I'm glad that you had that. I remember my assignment was not great during COVID, and I remember complaining about something, and I remember my recruiter being like, yeah, I know it sucks. But it wasn't a whole lot of like, it was kind of like they were exhausted, like hearing about all of like the qualms and stuff.
Yeah.
So yeah, I don't know. It's kind of having a good recruiter relationship will make or break an assignment sometimes.
I think so. I think so for sure.
One of the biggest questions I would get from people who were just trying to understand how travel nursing works would be about housing. You know, like, what do you do for housing? How do you find housing? Well, in your experience, what did you do for housing? Like, what was the best way to find housing for you?
I think the best and the cheapest ended up being Furnished Finder. Yeah. Which, for those of you who don't know, it's a website, and it's for traveling healthcare professionals. So it's kind of like Airbnb, but for longer term. And a lot of the times the people that are renting it are nurses or were nurses or something in the field. So they have like a soft spot, and I feel like they give you better rates. They're trying to profit, but not like Airbnb rates, you know?
Sure. Yeah.
So I think that was the best. I've done some through Zillow, some through Airbnb too, but yeah, just getting a furnished place I think is huge. Some people try to furnish themselves, and I'm like, that's too much for 3 months.
Yeah, I have done that. I did that once, but I didn't furnish it myself. I went through Court Furniture, and they just like would do a monthly. They like came in with all the furniture, and it's like a monthly. It's kind of a lot. I think it was like $300 or $400 a month extra, like to furnish out your place. But and then like that's always that. Yeah. It's hard because unfurnished places, I feel like, are normally not like month to month places either. So like you have to find a spot will take you month to month and then furnish it out. It was complicated. I've definitely.
Where did you do that?
Like, I did that in Virginia, around the DC area. Yeah. Finding housing in Furnished Finder is great because it's almost always month to month, I feel like. Yeah. Because it's like mostly travelers. But when you go out and look at, you know, like normal apartment rentals and stuff, a lot of times they're like bound by some contractual thing where they have to like, they increase the rates every time you like half a lease. So like 6 months is like X amount of dollars more than 12 months. 3 months is X amount more than 6 months. So it always just ended up being like astronomical to try to go through like a regular, you know, apartment rental place.
It never ended up being worth it.
Yeah, yeah.
For me anyway. Yeah. But everyone's different, and every place is different too. Because I think I can't remember where it was, maybe Santa Rosa, California, where I couldn't find anything on Furnished Finder. So you kind of have to like try to find a different avenue. Because some like the major cities are going to have a lot more than outside of the city.
Yeah, you got to get creative sometimes. I mean, we did Facebook Marketplace. Yeah, we did
Facebook
Craigslist.
Groups, like the Gypsy Nurse Facebook group. Sometimes, people will post, and sometimes people will post like looking for a roommate. So that would be a way to save money too.
Yeah,
I lived with roommates a few times while I traveled.
Were they travelers too?
No, I lived with one lady in San Diego, and she was a little bit older. She was like my mom's age.
Aww.
But she was so sweet. She was kind of like my mom, She was like my San Diego mom.
Aww. That's
so it was
awesome.
Cute. And it was like cheaper.
Yeah, it's so to be able to, save so much more.
Yeah.
I mean, it could be worth it if you're traveling alone, especially because then you're not really alone. I mean, you have like somebody you're living with. Yeah.
And then you can ask them like where to go for fun and, just the advice of a local and stuff is nice to have.
Yeah.
Better than being completely by yourself. I mean, depends. I think if you like that, I mean, some people like to live alone, but I think when you're in a new city, it's nice to have a person.
For sure. Yeah. I think that if that's like a barrier to you not starting travel nursing, then like finding a place with other roommates, I mean, that would definitely, you wouldn't be alone. You could figure out the area with somebody else. And then, when you're on an assignment, there are other travelers there. Sometimes they're alone, and then you can pick up and go to the same spot, with that other traveler. Sometimes people do that all the time.
Yeah, and then there's the MedVenture app out now. Have you seen that?
No, I haven't.
It's pretty cool. I mean, I wish I had it like 3 years ago. But it's kind of just like everything you would need to find friends during a travel assignment, or you can look up your hospital and see what the reviews are and who's worked there and what they have to say about it. And then they host like meetups and stuff like that. So it's kind of like a social media app for travelers.
I was going to say it's like Rate My Professor, but for
travel assignments. Yeah. But that would be a great way to like find a roommate too.
Yeah. MedVenture, you said?
MedVenture, yeah.
MedVenture. Okay. Oh, that's awesome. Yeah, I feel travel nursing has blown up because I feel like there are so much more resources now than there was, I mean, I was using Furnished Finder and like Facebook groups, like you said, and that was pretty much it. And I feel like word of mouth.
Yeah, it's like it really has blown up in the past couple of years. Everybody's leaving to travel.
Yeah. I mean, because like, how can you blame people, when you're permanent staff and like you see, travelers coming in, making this much more than you are and doing the same job, like
might as well.
It's fresh. Yeah. Right. Like, it's like, what do you have to lose? Especially when you're, burned out, like looking for something else.
Yeah. I mean, and you're in control of your own schedule. Like you can take an assignment and then take a month off if you want.
Yeah.
Request time off during your contract. Like if you want off for a week during Christmas, make sure it's in your contract. I just feel like you're so flexible as a travel nurse.
Yeah.
Like I took off from February till a couple weeks ago. So it's amazing how much freedom you can have, for sure. Yeah.
Let's talk about contracts because travelers are contracted staff. In my experience, I feel like I had a hard time vouching for what I needed sometimes. Like, I'm not a haggler.
Me either.
So, like, that would always be, my husband would have to help me with that all the time. He would, like, be in my ear when I was, like, trying to, negotiate contracts.
Yeah.
What do you think are some, really important things to have in your contract?
I think just making sure that the pay that you agreed on is correct. Obviously, that's kind of obvious, but and negotiating pay is kind of hard.
Yeah,
but
and I think that's. I mean, it's obvious to us, but some people don't realize like something that you verbally agreed on may not always make it to the actual contract. So like you do need to. Like, you need read the contracts. I guess that's, like, number one. You need to read
it, or have your dad read it, or your husband, or whatever.
Yeah.
Have another person look at it with you if you don't really know what you're looking at. Like, I didn't really know. Yeah. Especially when I first started. Pay. I always put, like I said, like the dates that I wanted off during the contract written down so that they couldn't mess with you. Because you can't really break the contract.
Yeah.
And I would always ask for a week whether it was over a holiday or just a random week, just like a Wednesday to a Wednesday, so that I could still work a full week in the front end and the back end. Floating policy, like that's something I never really thought of to add until I got floated to adults. But if you're like a peds nurse and you don't want to float to adults, like you could ask to put it in your contract.
Yeah.
Especially if it's something that you talked about with the manager during the interview.
For sure.
Like I've talked about that in interviews, like, oh, where would I float if I had to float? And they would say like, oh, the PICU, the CVICU, it's all peds, you know, or mother baby, something like that. And you would just do the babies. So I would always ask, but then I just assumed, oh, so we're good. But I think having it in your contract, it doesn't hurt.
It doesn't hurt. And I mean, honestly, if they have verbally said it, then there should be no problem putting it in the contract.
Exactly.
You know?
Exactly.
I got burned once. I think I had agreed to a day position, and then I signed the contract without. I just overlooked the rotation requirement, and I was working nights and days, and I was like, but I was I had signed it, so then I think I talked to the manager about it, and I was like, if this is what you need, you know, I'm here to help out the unit, I guess that's fine. But I just, like, we had talked about days. Right. And so I think she had ended up maybe putting me on more days than nights. But like that, you know, I had nobody to blame but myself. I didn't read the contract. Yeah. So definitely
read the contract for sure. Another thing I thought of is cancellation policy. I don't know if you've ever gotten like canceled, but I worked at one unit that was like 10 beds. So we usually had maybe 5 patients, sometimes one. And they need one nurse to take care of the baby, and then they would have one other nurse for an emergency. Yeah. So first to cancel is travelers. So I think just always putting that in your contract, like one time per 2 weeks or something like that, so that you're not being canceled every single day. Yeah. Because what's the point?
There's it's important to know what is in your contract in regards to canceling, because some hospitals will never cancel travelers because they assume that they're going to get paid regardless, but they actually don't know. In the contracts, a lot of times it says, you know, you can cancel a traveler like, you know, once every 2 weeks or something. Yeah. So I don't think I have ever gotten burned that way. I think that people just automatically assume that I'm going to have to get paid regardless. So they'll just, you know, float me wherever. I was always in larger units, I feel like. So somebody needed me in the hospital. Exactly. But yeah, I do have friends that, you know, they would just cancel them whenever their contract allowed them to be canceled. Yeah. And, like, you know, that's...
And usually I think you have to work the full 36 hours a week to even get your stipend. Yeah. So... Yeah, it burns especially if your hourly is, like, super low. Like, if you're making $20 an hour, but you miss out on your stipend, that's a huge chunk of money that you're missing out on. So... Yeah. Yeah, I think it's important to cover yourself that way.
For sure. Also, I think that if you're traveling, if you are staying at home on the off days that you're not working, you can also ask in the contract to be to work like 3 in a row or something like that. That you can negotiate that in your contract sometimes. Yeah. Like, you know, I knew a woman who I think lived in like South Carolina or something, and she would drive 5 hours north to do her assignments. She would stay in a hotel for 3 days and then she would go home. And like, I think it was in her and it was in her contract to, you know, block her schedule so that she could do that. Because I think she had kids and, you know. So I think if you're curious, or if you feel like if there's something that you might potentially need, like, there's no harm in asking to put it in the contract ever.
Worst they can do is say no. Yeah. And if they want you, they'll do whatever they need to, you know, make sure you can stay and Yeah.
Because a lot of times I feel like travelers, there is such a shortage, like you do have an upper hand. You have some negotiating power, I guess, is what I want to say.
Yeah, as long as it's nothing ridiculous.
Yeah.
Like, I don't know. I think if it's fair.
I want every holiday off. It's
right.
like,
yeah.
you're there around the holidays to help out the unit.
You should work a holiday, do your part. Yeah. But I think also, maybe request one off, make sure that, like, I've done the week around Christmas and make sure I have the whole week off, because if I say I'm off Christmas, then they'll put me on Christmas Eve or something, Yeah, I mean, just to make sure that you have that off, but then be like, but I'll work New Year's, and have that in your contract.
Yeah.
So it's fair.
Yeah.
And you're not being taken advantage of.
Right.
Because they will,
Yeah. You need to negotiate, right? You need to vouch for yourself. We started talking a little bit about interviews briefly. So let's talk about interviews as a traveler. I feel like travel interviews are unique in the sense that you kind of know going into that interview that they probably have already decided to hire you.
Yeah.
Like normally when you're interested in a job, there's like a lot of competition and you have to sell yourself, but like national shortage of inpatient nurses, like you probably have it in the bag. So there's a little bit of like, you're asking the manager more questions than they so much like they have your resume already, So what have in your experiences been some good questions to ask a nurse manager during like that interview?
Yeah, I think asking them about how many beds are on the unit, what's the acuity like, what would your expectations be of me? I guess just for me specifically, for like a NICU nurse, I always ask, do I have to go to deliveries? Because that's something I don't have experience in. I mean, I've been, but that's not something that I feel comfortable going and resuscitating a 23-weeker and bringing it back. So I think just knowing, do I have to go to deliveries? How much will I be floating?
Float
Is
policy.
it nights or days? Do I get to self-schedule? Because if it's a night position and they're just putting you on wherever you're needed, you'll end up working like
every other night.
On, off, and it'll be terrible. So I think making sure you have a clear understanding of what your schedule will look like there, the cancellation policy.
I think before COVID, I used to ask like what the underlying need for a traveler was, because you can kind of get a sense of like what the unit is going through before you even get there. Like, is it a brand new unit? Is it just a really busy unit with a low retention rate? You know, are they going through like EMR conversion? Did 5 people just go on maternity leave? Like, you could kind of you could get a little sense of like what you're going into before.
Right.
Like, and you could kind of, sometimes I would ask that question, sometimes I wouldn't. Like, I think sometimes you kind of get like, okay, this is just a very busy unit and they don't have their stuff together, and that's kind of going in there. But sometimes it would be like a really great unit. I'm like, I wonder why they need a traveler. And so it was helpful to like just get prepared.
That is a good question. I think it's a totally different vibe if it's like, oh, you're covering for someone on maternity leave versus we're overflowing with COVID patients or whatever it is.
Well, and it was, like I said, it was before, because like now it's like, okay, COVID.
Right. It's kind of obvious.
COVID. That's why.
For adult nursing anyway, it's kind of obvious.
I'm sure. Yeah. One thing to not ask the manager in your interview is about pay. I think that's like something that we should point out. Like, true. It's that pay is not a negotiable thing by your manager, and it's just going to make you look weird if you ask about pay, because it's the agency that is like facilitating. Agency and like the hospital itself decides what they're going to pay for travelers. So like, don't talk about pay with your manager, because they don't really even know. Like, I mean, I think they know what they're paying their travelers, but I don't think they have any leverage over.
Yeah, because It's just weird with the hourly rate and the housing stipend. So they maybe know the hourly rate, but I don't know.
Yeah.
But yeah, you negotiate it with your recruiter, probably before you even interview.
Yeah.
Yeah.
And another thing about just like avoid trying to get the same job with 2 recruiters. I think that makes you look, it's confusing and frustrating to the manager because you'll come in as 2 separate resumes and it just looks bad on you. You probably won't get that assignment. And then like, I think I don't know if the agencies like know that as well. It just like looks bad on all accounts.
Yeah.
So like,
I heard you get like blacklisted from a hospital.
Yeah.
I don't know if that's true, but
I think it's just really bad. I think
not worth the risk. Just go with the one.
Not worth the risk. Yeah.
Yeah.
But sometimes, I mean, with interviews, sometimes you'll have an interview. Sometimes you won't even have an interview. Like, I think just depending on what the need is, like I've had situations where they see my resume and I got accepted and I'm like, can I talk to the manager first?
Yeah.
Can I just like see what I'm getting
questions.
into? Like I would like to know what,
Yeah.
That's what I'm saying about like leverage. You do have a little bit of like, like, okay, I understand that you need me, but like, I don't want to work for, run around working with 8 patients. Like
it's like a compliment. They're like, oh, resume looks great. You're hired.
I'm like, wait. Why am I hired so quickly?
Slow down.
Something is wrong here. Yeah. Or have you ever done like the automated interviews, like the voicemail interviews?
Hate those. Yes.
I remember. I think so. Yeah. There's some places that will do automated interviews. So like beforehand, you just get a prompt, and you leave a voicemail. Essentially, it's like 2 minutes long about the prompt. And normally it's like, I don't know if I even remember
what makes
the
you
question.
a good team member, or what do you bring to a unit, or something like that.
Yeah, it's like, tell me a time where you were stressed and how did you deal with it, and you have to like pull some story out of your butt about,
It's nice when your recruiter will tell you those questions beforehand, and then you can kind of like prepare, and I would like take notes on it. But the first time I did it, I was going into it blind, and then it beeps, and then you're expected to just have an answer right away. And I'm like, I don't know. And I think I scored really bad on it. But then the second time I did it, I had my answers like prepared, and then I got like a really good grade on it or whatever, because they grade you, which is weird.
I think they end up like using the same software or something. It's like very generalized because I got the same question over and over and over again, like every different assignment I would apply for. So I knew too. You
knew your answer.
Yeah, I knew my answer. I like knew, the story that I was going to tell in like the 2-minute time slot. I got like a tight 60 seconds.
It's like a slightly exaggerated story that happened to you one time. This is perfect.
Yeah, right. And it works. So sometimes you'll get those too.
Yeah.
So. A question that I used to get all the time, and I still do, is what was your favorite place to go? But I feel like a better question might be like, what assignments, if any, almost made you stay and why?
Oh my gosh. I feel so lucky because I loved everywhere that I went. But I think my favorite place was Seattle, just because I fit in there. Like, I love the mountains and that hiking.
Yeah.
It's just so beautiful there. So I would definitely go back and live there. But I loved Santa Barbara too. And that was kind of like a pleasant surprise because, of course, like I've always heard about Santa Barbara. I knew it was on the coast, but I didn't know exactly where. There's a lot of Santas in California. So I was like, I don't know which one this is, but it sounds good. And I kind of just ended up there because my contract in Denver ended up getting canceled in March. Last year. Due to COVID. Yeah, okay. 20, whatever, whenever COVID started.
Yeah.
How many years has it been? I have no idea.
What year are we in?
It's been 10 years. Feels like it. So I got canceled in Denver. It was kind of scrambling to find a place. Found this Santa Barbara job. I was like, sounds great. I still have my California license. Ended up there and stayed for 6 months. And I loved it.
Yeah.
Yeah. It was like a great hospital. It was a great place to work. But also just a great place to live, and just biking to the beach and being able to be outside. And
that sounds amazing.
Yeah. it was awesome.
I just went to Santa Barbara for the first time, and Seattle for the first time, actually, back in
nice.
April. I had taken off, I think I was still a traveler, and I had 2 weeks off. My husband and I were supposed to have our wedding reception in April, and then we ended up rescheduling to this coming November. But I had like 2 weeks off, and I was like, well, why don't we just like take a trip? And we ended up going from San Diego to Seattle. We like drove up the coast.
That's awesome.
It was great. And Santa Barbara was beautiful. We went to the botanical gardens there. Mm-hmm. Oh my God. It was just out of a storybook. It was so pretty.
Yeah. So gorgeous.
And all like flowers. The Spanish style, like, you know, like the red roofs and everything.
Yeah. It's so nice.
Yeah.
And always nice weather.
Yeah. The weather.
I love like the mountains behind the town. Mm-hmm. Yeah. It's just so picturesque. It's beautiful.
That's awesome. Is there any like units that you remember that stick out in your mind? Like, you know, I could have seen myself stay because of the unit itself.
I think that unit was my favorite there. Yeah. I liked it because, it was a level 3, which is where I come from. Mm-hmm. And for the listeners that don't really know NICU, level 4 in NICU is the highest acuity. So the level 4 is more like surgical babies, a lot of like older babies, ECMO, things like that. Mm-hmm. Level 3 is a delivery hospital. So more micro preemies. Yeah, just more preemie focused. And then if they need surgery, we would send them to a level 4. So that's just where I feel the most comfortable. And it was a level 3. So I liked that. And they did some surgery. So it was like GI surgery. So I liked that too, because I learned something new, like G-tubes, we had an ostomy, gastroschisis, different things like that. So I feel like I learned some things, but it was also in my comfort zone.
Yeah.
And the people there were so nice, and I felt like after a few months there, I felt like I was a part of the unit, so I could have definitely stayed there. They were very welcoming.
Aww. What is considered a micro preemie?
Micro preemie, I think would just be anything less than, I think technically 30 weeks and under. So 23 to 30. So they're just itty bitty and guys. Yeah, very fragile and vulnerable little burrito babies.
Oh. What are some of your, we're talking about travel nursing this whole episode, but I don't know anything about NICU. We're going to have you on another episode so we can talk about NICU. But
yeah,
what are some of your favorite NICU patients?
I do like the little itty bitties the best. I think they're the most fun to take care of. Because it's not similar, but I don't know, in a way similar to like why you would want to go to ICU. You know, you want to take care of sick patients because of that like adrenaline rush. So I think those are the patients that would be like more similar to an adult ICU, just because they're on drips, on the vent, different things like that. So I like that because you're, I don't know, doing more nursing tasks.
Sure.
I mean, there's so many different types of babies that are in the NICU, but I do like the little ones for that reason. And I like to teach parents and how to take care of them because it's so different than having a full-term baby. I mean, 100% different. So I like that. But I can't
imagine. Thinking about your baby, you know, so much, and then you know,
and you have to leave them there,
completely going a different direction than you had anticipated.
No one ever wants to come see us. It's like, sorry you're here. I mean, I love my job, but I'm sorry you're here. Because they have to leave their baby every day, you know, go home, and I don't even know how you would sleep wondering what's going on or how they're doing. Even the babies that are there for just a couple of days, it's just so difficult, but I love it. But we get full-term babies too, you know, for infection or respiratory distress, things like that. But I think mostly, I would say the majority of the babies that come are premature.
Okay. Yeah, that makes sense. God,
Yeah.
you said ventilator, and I was like, oh my God, what does that look like? The little baby ventilator.
Just a tiny little endo tube. It's like this big.
I cannot.
A chest tube looks like a Q-tip.
Oh my gosh.
It's crazy.
That's wild. Oh.
Meanwhile, I go to adults and I'm like, everything's so big. Oh my God.
This is massive.
Yeah.
Yeah.
So scary.
Oh gosh. Do you have any advice? We kind of talked about how, like, travelers that have a hard time transitioning in that first little bit, but do you have any advice for somebody who might be having a hard time transitioning into traveling? Like, in those first few weeks of panic, they're like not doing this right at all. Maybe they made the wrong choice. Like, what do you have any advice for those people?
Yeah, I think it's hard. I know some people who've given up, you know, they've even canceled their first contract because they weren't, I think just like the anxiety of it, and it's a huge life shift, and it's definitely not for everybody, but I think my advice would be to just give it a chance. It's not permanent. It's 3 months, usually. Usually it's 13 weeks. And I think you can, I don't know, I think you can do it, like, and if you hate it, you know, then you can go home after that. But I think giving it a fair chance and at least doing one full assignment.
Yeah.
But there's so many different ways to make yourself feel more at home. I think, like, establishing a routine is huge. Like, I joined a gym everywhere that I went, or I would have like an LA Fitness and membership, and they're pretty much everywhere. Yeah. So doing that, like having your routine to make it feel more like kind of like you're at home, and meeting friends. I mean, a lot of the bigger units that I went to had other travelers, and we always stuck together. And it's like instant friendship because you already have so much in common. Yeah. Because, we both went through the same thing. We both did this crazy like thing, and we moved across the country and want to go on a hike, and let's exchange numbers. And I just think it's easy to make friends. Yeah. I was at the one unit I was talking about that was 10 beds. I was the only traveler. So it was harder to make friends there, but there's like Bumble BFF or the MedVenture app now. I think there's a lot of opportunities to meet people. Yeah. So I think doing that, and I think part of being a traveler is putting yourself out of your comfort zone. Yeah. So it can be hard, and it's like, oh, I'm shy or I'm nervous, but the more you do things like that, the more you grow. And I feel like, at least for me, I feel like now I can do anything. Like I can move anywhere and be happy. I can figure it out. I figured it out so many different times before. And then in the hospital setting, like, do I know everything? Absolutely not. But you figure it out. Yeah. You know? And I feel like that confidence that comes with it, it's like, it's just so worth it. So stick it out and just do it.
Yeah. I 100% agree. I think that traveling boosted my confidence so much. Like there's so many obstacles that I've overcome, that I've like figured out, you know, how to do things. And like, you know, a lot of times you do it on your own, you become like very autonomous and independent. And, you know, those first few weeks are really hard, especially your very first assignment, because you don't know how to go about all of this. But like you said, like, make friends, you know, make the most of the assignment, like go do things in the area.
Yeah. Find new hobbies. There's so many, like, depending on where you are, but like I took a surf lesson in Santa Barbara, like go do that, like go hike, go to the national parks. Or if outside's not your thing, I don't know. I mean, I feel like there's so many different things. Yeah. Breweries, restaurants, food scene. Yeah. As long as we're not in lockdown. Yeah. That's food scene outdoors. Yeah. Takeout on the beach.
Yeah. Figuring out what your town is like best for, you know, what the city like does really well, you know. I feel like that's the secret to having a really good experience, is just like make the most of where you're going, you know, make friends, put yourself out there. You know, you're going into different new circumstances as a traveler. So like, just fall into that. Like, make the best out of where you're at, what you're doing.
Yeah. And I think like, if you're booking flights home every weekend or something like that. You're not going to make the most of it. But then I think on the other side of it too, like have your family come out, show them around your new place or your friends, like have people come and visit you, and that can make it really fun too, because then you're sharing in all of those great experiences together, like with the people that you love. So then you have something to look forward to. And
I think that it kind of boils down to what you want out of the assignment. Like, are you there just to make money? Like, if that's true, then, you know, you just do your job and make that money and then go home. But like, if you're there to see new places and explore new things and, you know, make new friends, like launch yourself into that. Like,
I agree.
So we are similar in the fact that we have both kind of hung up our travel hats recently in exchange for some stability. How do you feel about leaving traveling for the time being? Are you like, are you excited to be a permanent staff nurse? Are you like scared? Like, what are your thoughts about it?
I think I have mixed emotions for sure. I definitely had one night where I had a few drinks and I cried because I was like, oh my gosh, this has been my identity for 3 years. And it really is, it's your identity, because when you're at work, you're a nurse, but then on your days off, you're a travel nurse. Like, you're traveling, you're exploring. So I feel like that was my life, you know? So it is hard in that way, but I think I am excited just to have some stability for the first time in a long time. Like, I have my own house now, and we're furnishing it with our own things. Making it our own. Like, we have our own bed now. I can't tell you how good that feels. like sleeping in other people's random beds for 3 years. It's just like, I mean, sometimes they're fine, but other times it's like very not fine.
I've stayed on an air mattress for 3 months once.
Oh my gosh. Really? Not very comfy.
No, would not recommend.
No.
But I mean, you can do it if you want. But
you do, you can do it.
It is nice having your own stuff, like having an apartment with all of my own belongings. It is,
nice, and just like not worrying, like, where am I going to go next? Where am I going to live? Like, I have to pack my stuff all up again, and it is stressful. I mean, you get used to it because it's your life. Like, you're like, okay, every 3 months we're squeezing everything into the Subaru, and but I mean, in a way you get used to it, but it never is fun. That part is never fun. So I'm relieved about that, and I'm excited to be at a staff job now too, because I think as much as I've learned traveling, I think I'm going to learn a lot as a staff nurse now too. Like, as a traveler, like we talked about, I feel like I'm flexible, I'm adaptable, I've worked with tons of different people, I've grown a lot as a nurse, and like communicating with parents, communicating with doctors, confidence in myself and asking different questions. But I don't know how it is or how it was for you, or how it is for like an adult travel nurse, but at least for me, I feel like they gave me a lot of like easier assignments, or busier, like busy easy. So like I'll have the most amount of patients, but they're all stable, rather than getting the sickest.
Sure.
So, I mean, every once in a while I would, but I think I am a little bit out of practice with my like critical care skills.
Okay.
So I think I'm excited to get back to that and to feel really confident, and then eventually be able to like teach newer nurses. And kind of like go the education route and just pursue different things. I mean, I don't think I'm done with traveling, but I mean, I might come back to it in a couple of years and take more assignments, or just take trips. But we'll see. I think I'm excited, but there's pros and cons again.
Yeah, absolutely.
Yeah. How do you feel about it?
I'm excited to know a unit really, really well, and like to be a resource for other people, and to like know the policy really well. And because I think that's sometimes the most frustrating thing I think about traveling, is just kind of having like a superficial grasp on how everything works, enough to do your job from day to day, and as opposed to like really understanding how everything works. That I feel like have been gratifying so far. Yeah. I mean, I actually switched acuities. I was a med-surg traveler, and now I'm in the ICU. So like I'm learning a lot more now. But I mean, traveling just expedites your learning too. I mean, you probably see from different NICUs, you see different populations, you know, based on where you go. And
very true.
It just like makes you learn a ton too while you're traveling.
You do.
I mean, you don't always stay in the same, like as med-surg, they like, you know, threw me into so many different types of, like, that's such a bucket of
everything.
Nursing.
All ages. All different kinds of illnesses.
Right.
You just have to know everything.
Like you can just take 4 people. That's all you need to know, right? You just take You're 4 patients at a time. That's fine. It doesn't matter what.
Completely new charting system. Don't know where anything is. Okay. I'll manage.
I can figure it out. But, it is bittersweet for sure. You know, I loved that freedom and that autonomy, and I'm definitely going to miss that. And like the identity, you're so right. I mean, like I was so proud of being a travel nurse. You know, it was such a fun job description. Yeah. And like being
so interesting,
able to move every 3 months. I mean, but it's a give and take for sure. So I think we also like that door isn't completely closed, but at the same time, I'm like still allowing myself to like really like fall into this new job and like just kind of see where that takes. You know, I can see both paths. Like I can see myself like staying here for a really long time and being a resource and, you know, like maybe helping educate other nurses, precepting them when I get confident, you know. But I also like in the back of my mind love that travel avenue. So
I know. I wish I could like take an assignment for 3 months and then just go right back to the staff job without losing the staff job, you know?
Yeah. Yep. I know. Oh, gosh. Yeah. Well, I think we are going to end it here. But I am so happy that I could have you on today. This was an awesome conversation. Thank you for talking to me about traveling. And
thank you so much.
I really hope fun. It was great. And I think this will be really great for people that are interested in traveling or maybe just trying to find their footing, you know, getting tricks of the trade.
Yeah, I hope everybody out there who is interested in becoming a travel nurse looks into it more and pursues it, because for me, it was the best thing I've ever done. I'm sure you feel the same way.
It was the highlight of my career so far.
Absolutely. Absolutely.
Yeah. All right, Hannah. Well, we will talk to you soon. Thank you so much.
Sounds good.
Bye. That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubman and Sam McKay, and Aidan Dykes for the music and editing. Until next time, take care of yourself.